Greetings and welcome once again to another moment in time on the Professor Kareem Ainsley Encounter. Yes. Let us get into some conversation concerning the anti-globulin test. I know that many of you may have heard of the anti-globulin test prior, but if not, well, you're here to get a better understanding of what this test is all about. So before we get into any details, the anti-human globulin test, which refers to as the Coombs test, is based on the principle of the anti-human globulin AHG. That is something that you should be familiar with and should take note of. The AHG obtained from immunized non-human species that binds to human globulins such as the IgG or complement. So IgG and complement are two important entities that we need to take into consideration, especially when we are trying to investigate a reaction. Either these can be free in the serum or attached to an antigen on the red blood cell, that is the RBC. So we're looking at IgG and complements. The anti-human globulins test, or the AGT, is an essential test methodology which is used to monitor and investigate transfusion in transfusion medicine practices. This is done pre and this is done during and also post, providing that there are any things that would cause a need for further investigation. Without its use, patients' well-being, as you know, patient safety is our biggest priority. Patients' well-being would be adversely affected, which is in a negative manner. So what we want you to make note of mentally is that there are two types of blood group antibodies, and you guessed them correctly, the IgG, yes, and the IgM. But because of their larger pentamer structure, the IgM antibodies bind to corresponding antigen and are directly agglutinated in red blood cell suspension with saline. And you can see the impact of the IgM taking place when we have our ABO blood grouping being done. Some IgG antibodies are termed non-agglutinins or incompatible or incomplete rather antibodies because their monomers structure is too small to directly agglutinate sensitized red blood cells. So we're seeing that the IgMs are large molecules which gives agglutination in real time, usually at room temperature, and can even agglutinate at other temperatures. But the IgG, they are a bit smaller, and the care must be taken in ensuring a reaction that is significant, meaningful, and one that can be interpreted. And usually the IgG reacts significantly at 37 degrees. Yes, you can have an immediate spin that gives you a reaction, but the ones we are more concerned about are the 37-degree, because we know that the body operates normal temperature at 37 degrees. And when we are thinking about a transfusion reaction, the blood is going to be infused into the patient, and at 37 degrees, the body will be functioning normally. So 37 degrees is the point at which we want to be very careful that everything is okay. So adding AHG that contains anti-IgG to the red blood cell that has been sensitized with IgG antibodies allows for hemagglutination of these sensitized cells. And we use an antibody to observe the formation of antigen-antibody complexes that would otherwise go undetected. And you know, if we miss antibodies, they can cause transfusion reaction, they can cause febrile reaction, they can cause all manner of adverse effects to the patient health and safety. But we know that some blood group antibodies have the ability to bind to complement to the red blood cell membrane. In such cases, an anti-complement component can be added to the AHG reagent, rendering it polyspecific. Antiglobulin test detects IgG or complement sensitized to red blood cell. So we have poly, which means more than one, and then we have a monospecific, which is just one. So the AHG in a nutshell basically is the antiglobulin test, which refers to, sometimes called, the Coombs test. So if you hear the word Coombs test, it is talking about the anti-human globulin test. And the things that we are concerned about are the IgG and complement reaction. These are significant, especially during the process of transfusion and determining agglutination and complement activation, because at a particular juncture, any time we see any form of agglutination taking place within the body, that there is a cry for help from the body to us, because nothing in the body should be agglutinating on itself. And with transfusion reaction taking place, you know that that can compromise the life of an individual. Someone can die from the wrong blood being transfused to them, and that is why care must be taken in assessing and performing these testing methodologies appropriately. We'll move in a little while further as we investigate the transfusion testing procedure by the tube methodology and also by the gel technology to see how the check cells come into play. Because sometimes we may do a reaction and we get negative, but we have to check those negative reactions to ensure that they are truly negative. So if they were negative and we use a check cell, they should give us a positive reaction. So this is where we're going to be pausing our conversation on the anti-human globulin test, or the Coombs test, at this time, as you seek to digest this information. And the next time we'll go into the history of the antiglobulin test, so you can see when did this testing methodology became so prominent, and you will realize that it was not so long ago. Thank you for joining us and spending some quality time with us here on the Professor Kareem Ainsley Encounter. It was indeed a pleasure to feed you with this free resource. Continue to enjoy, and if any value was added or you got a new perspective, please go ahead and hit the like and subscribe button. And thank you once again, and see you in our next sitting. Until then,